last summer, my voice started to strain, and it got a little bit worse and a little bit worse. Dr. Scott Butler, he ran tests, and my wife and I had an appointment, and I got the news. I've got a disease that nobody and very few people understand.
Breaking bad news is not an easy thing, and it hurts the patient, it hurts the family.
I don't think there's a whole lot that can be done. As several writers have said, it's a death announcement. You just don't know how long you have.
As soon as Vic got the diagnosis, it was less about him and more about everyone else.
A lot of people can't afford the equipment. I said, find their foundation.
It's not a cheap disease. It's very expensive. Most reports say the average cost is around $1 million for caring for a patient with ALS.
Within a couple weeks of his diagnosis, Vic said, then I would like to create something or make something so that people that don't have things could have access to them.
I would look down the road at this foundation. I'm gone. Have the money to help those that can't help themselves.
There's not nearly enough research going on to understand what's causing this disease. ALS, like all degenerative diseases of adults, is woefully underfunded at the federal level.
A full-time research coordinator is what's really needed to take that translational research from the bench with what Jim's doing, what others are doing from a science standpoint, and give those to the patients right here.
Harper's Hope is critical to providing the seed funding for us to be able to figure these things out so that we can then go and search for other outside sources. Without something like Harper's Hope, we wouldn't get this off the ground.
We're not looking for hundreds of millions of dollars, but to be able to privately fund a research clinic in Richmond that can treat people and give them hope.
And Vic has really then been the champion that this should be as well known as other diseases. It should get the same financial resources.
I think you gotta go ahead and keep moving through the community.
When people get the disease, they can advocate for the disease for only a brief period of time. They lose the ability to talk, they lose the ability to get around.
He says, I know that I'm dying. But that doesn't take away from the fact that people need to be aware and people need to know what ALS is.
Our investment in research and clinical care and all of the neurodegenerative diseases has been driven by patient advocacy and by individuals who have stepped forward and said, I want to take this on.
It just is natural. It should be here because what you're dealing with is education of the patient, the family, the public.
Vic, interestingly enough, is no different than every ALS patient. They are the sweetest people, they have wonderful families, and they all fight.
I have been privileged to witness the courage of the human spirit played out in ALS patients like I've really never seen it anywhere else.
He knows that what he's doing now will have no benefit to him personally.
And if we could raise enough money to help people that I will never see and never know, my family and myself would be very happy. I think the greatest pleasure is helping other people.